Now, migraine is something that really affects daily life, mostly in your 30s and 40s. But look, even in childhood, it can cause nausea, vomiting, poor performance, lack of enjoyment, even being taken out of school. It's quite a serious cause of pain. We have some very good migraine medications. Sometimes painkillers alone can't relieve it. Patients, of course, when they come to us, we don't just give them painkillers. Is it really a migraine first? First, we want to make a diagnosis. We definitely want to film it. Are there different events that mimic migraines? Are there any vascular disorders? Is there another problem we can solve? That's why we look at blood test results. There we check blood pressure, blood sugar, chronic diseases, thyroid and vitamin levels. All of these are actually important for us. If everything is fine after these, then based on what the person describes, in other words, their history, we diagnose migraine. If we say this has happened 5 to 6 times, yes. If it fits the migraine criteria, throbbing pain, causes nausea, gets worse with exertion, increases when bending over or standing up, if it gets worse when coughing, if there is this kind of throbbing pain, and if there is sensitivity to light and sound, then we say you have migraine. Now, after diagnosing migraine, we have certain treatment protocols. If the attacks are infrequent, like once or twice a month, and can be controlled with medication without much difficulty, we don't do much more. We just provide acute treatment aimed at relieving the pain. But if it's very frequent, for example, if it happens 2 or 3 times a week, or if an attack starts and lasts for several days, making it impossible to go to work or leave the emergency room that day, etc., in these cases, we also provide what we call prophylactic treatments, more preventive therapies that help reduce and space out the pain. But now, over time, these treatments have evolved. There are vaccines now, even a migraine vaccine. There is also migraine Botox. Of course, these are more expensive and different treatments that we tend to reserve for later stages. We may not recommend them to everyone either. First, can we reduce it to once or twice a month with certain medications? Or can we train the person to control this pain? We look at this first. We have very good migraine hotlines. Of course, we want them to discover what triggers it, because one person's migraine may not be the same as another's. There are people who get migraines during their menstrual periods at regular times. Not getting enough sleep, sleeping too much, staying hungry for too long, being under a lot of stress. Sudden acute stress can potentially trigger a migraine. Windy weather can also be a trigger. What we eat and drink, especially fermented pastries, can be a factor. Fermented drinks, nuts can also be triggers. Bulgur, onions, things like curry, cinnamon, these highly aromatic spices can even trigger migraines. Our goal is to inform patients, to give you some information on this, and to encourage you to track your pain. What do you suspect is causing it? What were you doing when your migraine started? So it means you need to reduce those things. For example, chocolate sweets. The cocoa content is directly related. For some patients, it's directly related to sugar. We want to raise awareness about this issue. And actually, our goal is for you to never have to go to the emergency room, maybe not even to the doctor at all. Of course, I'm talking about patients who have already been diagnosed and evaluated without having to go in. We want to be able to end our migraine attacks within 1 to 2 hours without any loss of work productivity, so we can get back to our jobs and daily lives. That's what we want, and that's actually our goal.
Thanks a lot.
Thank you too.